Good afternoon, even everyone. My name's Shauna. I'm the community engagement lead at Colostomy UK. I'm also joined with Dave. He's one of our very brilliant Colostomy UK volunteers, and he's based in Northumberland. Today we'll be talking about what a stoma is, how Colostomy UK supports people, and what it's like living with a stoma. So over 200,000 people in the UK are living with a stoma. That's 1 in 335 people. It's likely that you've interacted with someone living with a stoma, whether it be in a personal or professional capacity, and if you know it or not, because it is a hidden condition. Some people might not choose to share about it. This could be due to a personal choice, complex feelings around shame, or societal fears. So just going to the basics, what is a stoma? A stoma is a surgically created opening in the abdomen, and that allows waste to leave the body. So there's 3 types of stomas. So they are the colostomy, an ileostomy, and a urostomy. So depending on various factors, it may involve part of the colon, the small intestine, or the bladder. But sometimes people have 2 bags as well, so one for urine and one for feces. They can be temporary or they can be permanent. So everyone's journey is different to why they have it, what type of stoma they have, and the type of challenges that they can face. So there's quite a lot of misconceptions around living with a stoma, and that can really contribute to stoma stigma and misunderstanding. And for example, a lot of people think that a stoma is an open wound, and it's not. And stoma formation is life-changing. It has some challenges, but it's also life-saving and it allows people to carry on living a normal life. So how do people manage a stoma? People use a bag that attaches to the skin around the stoma, and that is known as a stoma bag. This bag collects waste and it can be emptied or changed as needed. So the right product and the stoma care management is needed to prevent any issues they may have with stoma management. So leakages, blockages, skin irritation, infection, to make sure that everything's functioning properly. So this can lead to additional planning for people when living with a stoma if they want to engage in their usual activities, for example, go to a sporting event or doing physical activity. So it requires ongoing management and especially specific facilities when using the toilet, so stoma bags can be changed cleanly and safely. And due to the nature of hidden conditions, sometimes people feel like it's been reported that some people living with a stoma have been denied access to appropriate facilities such as stoma-friendly toilets or disabled access toilets, or they've been challenged on their condition. So some of the reasons people have stomas, they've had this surgery is it's essential for many people to live safely and comfortably. There's many reasons from cancer of the bowel, inflammatory bowel diseases such as Crohn's or colitis, diverticulitis disease, trauma. This could be from accidents or surgical complications, even malformations in newborns or injuries from childbirth. So what people might feel challenging and what they might worry about is in public or by themselves is it going to be visible? Will people hear noises or notice smells? And what about leakages and finding the right clothing? Can I still partake in usual activities? And understandably, this can really impact people's confidence and their connection to their local community, and what they choose to do. So last year we did a beneficiary survey. So in 2024, what's been reported in the Northeast is that 46.6% of people living with a stoma have reported leakage issues. So that's almost half of the stoma community in the Northeast who may be in fear of continuing daily life or leaving the house due to stoma bag leakage issues. And this might be connected to the next statistic. So only 23% of people living with a stoma in the Northeast saw a stoma care nurse last year, and that is below the national average of 35%. So this means people might not be receiving the appropriate care, or they could be using the wrong product for them. And over 25% said their mental and physical health has been negatively affected because of having the stoma surgery. So these stats kind of tell us that people may need more support, both in health and social care, and emotionally as well. So I think societally, it's really important for us to create a world that's inclusive, accessible, and accepting. And this is because it really could be any of us. It could be your gran, for example. It happened to mine, and I wouldn't have known about what a stoma was or what it was like living with a stoma until knowing someone personally and seeing the challenges that can present, sorry. So it's important for us to reach beyond the stoma community to raise awareness and education on living with a stoma. So I'm really grateful that we have the opportunity to speak here today. It could also be your nephew. Even babies have stomas. There may be a stereotype of what a person living with a stoma might look like, but it can really happen to anyone at any point. It could be an older person or it could be a younger person. It could even be your neighbour that you don't know about. Like I said, not all conditions are visible. Many people choose not to talk about their stoma because of stigma and embarrassment. So here's where Colostomy UK come in. So what we want to do is support, empower, and advocate for people living with any type of stoma. I know our name is Colostomy UK, but we do provide support to anyone living with any type of stoma that's been mentioned. So we provide practical advice and emotional support. And this includes health and social care professionals as well. If you come across someone who's living with a stoma and you're unsure and you want to speak to someone, you can contact us as well. Carers can contact us and loved ones can too. And this is at any point of someone's stoma journey. So our support services, we offer a wide range. There's a 24/7 stoma support helpline, and 99% of the team will have lived experience of living with a stoma. We have so many different experiences. For example, people have had reversals, people have two stomas. So you can request to speak to someone about a specific topic and be linked with a person who has experience with this. We also have a live chat on our website. There's a closed Facebook support group, and that has over 12,000 members across the world sharing stories, tips, advice. We have over 30 literature titles to access on our website or to order, and this is free of charge as well. That can be from diet, exercise, stoma management, caring for someone with a stoma. We provide workshops and awareness trainings for organisations and professionals as well. We also support people to set up stoma support groups. We've currently set up 5 across the UK. We also have a quarterly support magazine called Tidings, and this provides real life stories and tips from professionals and community news. You don't need to sign up or pay for any of these services. It's membership free. These resources can be accessed by health and social care professionals, as I've mentioned. And we also do things like provide a bi-monthly newsletter to health and social care professionals, and that's to keep people updated, reminders of what we do. You can order the literature for free to have physical copies as well. We do the stoma care workshops and the stoma awareness training, and this is to tackle staff attitudes and understanding on how to provide stoma care to an individual. We also support organisations to make their toilets stoma friendly by giving guidelines and advice. And we want to provide opportunities to empower people living with a stoma. For example, getting active through our Active Ostomates programme. This provides free and gentle exercise classes to get people back into sports. And the next one starts in September. So you have yoga, art, mindfulness, Pilates. We also want people to challenge themselves and stoma stigma. For example, getting involved in sporting teams such as Team Colostomy UK, in which players living with a stoma or a chronic condition are able to play a full contact sport such as rugby league, which proves that people living with a stoma can still do anything they choose to do. They take part in challenges like walking. We have our Step Up for Stoma challenges, and we also really think it's important that people know their rights. For example, with accessible travel in airports, and this is to ensure that people's dignity is protected. So I've previously mentioned about stoma-friendly toilets. And this slide here gives a little example. So we work with public venues to ensure that toilets are accessible for people living with a stoma. So what that entails is a full-length mirror, shelves for equipment, hooks to create more space for people, and then disposable bins, for hygiene and dignity. We also have appropriate signage that people can get from us for free. We also want to accessible travel. So flying off surgery can be really daunting, and people will talk to us about security checks, insurance, baggage. And we're involved in 9 accessibility forums across the UK, in which we provide feedback from people living with a stoma to provide input on training staff and helping shape better travel. So if you want to reach us, you can reach us on email or by the phone as well. And in the north, we have a few support groups. We have Berwick, Durham, and one in Newcastle as well. But like I said, if people want to set up their own support group, they can contact us directly and we can provide guidance around that as well. So now I'll hand over to Dave, who is one of our volunteers.
Thanks, Shauna, and good afternoon, everybody. As Shauna said, I'm one of the volunteers for Colostomy UK. I volunteer on the helpline. I don't know why, but I always seem to do a Monday. So if anyone rings up on a Monday through the day, they'll be more than likely speaking to me. We'll provide help and advice on lots of topics, speak to lots of different people. A lot of the time, people who phone up who are new ostomates haven't spoken to anybody else who has a stoma. I often get, "Oh, you're the first person I've spoken to who's like me." I must admit, when I first had my colostomy, I didn't speak to anybody once I came out of the hospital. I didn't know about Colostomy UK's existence. It was only by chance that I stumbled across Colostomy UK. Giovanni, one of the team members of Colostomy UK, was giving a talk to the organisation that I worked for. And I thought that sounded like a good thing, and it sounded like it's something I could contribute to. I come from a view of having a colostomy with a positive mindset. It's really changed my life for the better. A lot of people I speak to, and it tends to be cancer patients, people who've got cancer of the bowel or something like that, have gone in for an operation and weren't expecting to wake up with a stoma. They seem to find it more difficult than people who've come to having a stoma for other reasons. I had mine because I had Crohn's disease. And cancer patients seem to be the ones who struggle emotionally and find it hard to accept. So if you're associated with cancer care and dealing with cancer patients, emotional support, I'm sure they would benefit from that. Typical questions I get lots of questions about, is it okay if I do this? Can I eat this? People don't know what they can and can't eat, what they can and can't do. And a lot of it's trial and error. This is just me. This is my story. You've met one ostomate today, but I eat and drink anything I want, really. The only thing I limit is fizzy drinks. Shauna showed a slide about ballooning. That's something that I suffer for. I tend to find if I have a fizzy drink, I get terrible wind. So I've cut out all carbonated drinks. I have the odd pint when I'm out, but I tend to stick to wine. Not that I'm a big drinker, but that's a different matter. And curry. If I have a curry, I know that my bag's going to be active through the night. But I love curry, so it's something I'm prepared to put up with, and I don't have curry all the time. It's a treat. But I tend to tell people it's trial and error. Give something a go. If it works, great. If it doesn't, well, perhaps next time try something different. And it's the same with activities as well. I run, I go to the gym, I play walking football. I haven't fancied rugby league, but that's just a personal choice. And again, being active, you can do anything you did before, really, and more. Because I had Crohn's disease, I was going to the loo every half hour or so. Now I can go off into the countryside with a dog for an entire day and not worry about things. We get lots of calls about travel. What's it like going on holiday? I've been an ostomate for 5 years. I've been on the helpline for about 2 years. And I've been abroad about 6 times. I've been to America twice, done a long haul. The only difficulty I found with that was the toilets on the aircraft. I had to empty my bag while I was over the Atlantic. I'm 6'3" and the toilets aren't very big, so it was a bit of a struggle, but that was the only problem I found. Airport security, the new scanners, they've got them at Newcastle Airport that do pick up colostomy bag. I've been taken aside into a room and asked to show them my bag, which I don't have a problem with. I go topless on holiday. I don't have a problem with body image at all, but lots of ostomates do. I've had my hands swabbed. I think that's less intrusive way of dealing with it, but it's just the way things are going these days. So there was an example of typical calls we get. People of all ages, we do get calls from healthcare professionals, concerned family members, and people living with a stoma themselves. Just a bit of background on my story. As I said, I've had a stoma for 5 years. I was diagnosed with Crohn's disease 8 years before that. When I first met my surgeon, the first thing he said was you're going to have a stoma. And I was absolutely petrified. I was terrified of going into hospital and having the operation. I hadn't even considered what it was like having a stoma. It was just the operation scared me. Scared me so much I actually did a degree to try and put the operation off. And I used that as an excuse that I couldn't have an operation until I finished my degree. But I wish I'd done it sooner. It's been a complete life changer for me for the better, as I've said. I can do anything I want now, go for long walks that I've mentioned. My job, I travel a lot. I'm, as Shauna said, I'm based in Northumberland. I've driven to Plymouth, which is an 8-hour drive. I couldn't have done that before I'd had my stoma. I have had issues. It took about 6 months for me to get used to my stoma and to manage it and not suffer from leaks, which isn't pleasant, especially when you're away from home. Some people who live with a stoma limit their travel, limit going out of the house because they do have leaks. And if you're out and about in public and your bag leaks, it's pretty embarrassing. It's not a pleasant experience. So, like I say, it took me about 6 months to be able to manage my stoma properly and be confident that it wouldn't leak. And I was on top of things. I have had issues. I've had a prolapse, which was surgically repaired. I think it was about 3 years ago. And I've had a hernia. I think about 80% of ostomates will get a hernia. I had mine repaired in January. It didn't particularly cause me any problems. It was more aesthetics. It was like I had half a melon on my stomach. What else can I tell you? I don't really have any day-to-day issues. The only real issue I had was I was actually allergic to the glue on the bags. And I've had to try about 15 different types of bags before I found one that worked. I did that through my supplier and just trial and error. My skin erupted and the bags were stopped sticking. And I had to, as I say, try different bags and I found one that didn't kind of degrade and make my skin worse. But the bag I've got now, I wear a drainable bag. My kind of bowel works. I change my bag once a day and I empty it around about tea time. And that's how active my digestive system is these days compared to about 20 or 30 times a day when I had the height of my Crohn's disease. So from that, it's been a real life changer. You get different types of bags. Some people wear a closed bag that takes more changing during the day. There's two-piece systems as well where your flange sticks to your skin and then you just clip and unclip the bag. Shauna mentioned about toilets. I have a passion for toilets and an interest in toilets, which might be pretty sad, but there you go. It is work related as well. It's not all pleasure. I have been challenged when I've used an accessible toilet by other disabled people. I try not to use an accessible toilet if I don't have to, but if there's nothing else available, I will use an accessible toilet. Stoma-friendly toilets are great. Signage on the outside of toilets, reminding people that not all disabilities are visible. As I said, I'm 6'3", I run, I go to the gym, so I'm relatively fit. Don't look like I've got a disability, but that sign just reminds people. It's also a benefit if sanitary disposable units can be put in male toilets. They're always in female toilets, but if they're a male toilet, if you cannot use an accessible toilet and you have to dispose of a colostomy bag or urostomy bag, you can put it in the sanitary bin. So putting those in male toilets is a great bonus as well. In terms of output and noise, Shauna mentioned noise and smells. People are worried about. Unless you're changing your bag, there really isn't any smell. There's carbon filters on the bags, so you can be as windy as you want. It's noisy, but it doesn't smell. The only time there is a smell is when you change the bag and you're breaking the seal, and it really does smell. So people can be a little bit conscious of that. I know I am. That's probably the only thing that I kind of worry about a bit, but I carry a little air freshener around in my stoma bag that I take with me. And if I have to, I'll give that a little bit spray before I leave the toilet and just leave it pleasant for the next person. But yeah, I think that's about it. That's my story of life as an ostomate and being on the Colostomy UK helpline. If anyone's got any questions, I'll be more than happy to answer them. I'm sure Shauna would as well.
Thanks so much, Shauna and David. That's really, really, sort of great. And thanks, David, for sharing your, sort of own personal experience and your experience of being a volunteer as well. That's absolutely fantastic. Has anyone got any questions that would like to say? Please do put those in the chat. I guess one of the things I was thinking about was when you were talking about kind of local support groups. You say obviously you give support to people to kind of set that up. Can you talk us through, Shauna or David, how that would work? Do you help to kind of generate, sort of other volunteers and sort of like people? How does it work with the support groups?
So people can contact us, given their interest that they want to set up a support group in their area, and we'll have that initial conversation with them. We can use our database where we have kind of over like thousands of people, and we can look in that area and we can send out an email to see if anyone's interested with the setup or join the support group to kind of gauge what the interest would be for that. And then through that we can help them build a committee. We'll provide documentation. It's top 10 tips really, but it's like over 8 pages, so they are very long top tips that just kind of go into detail about finding venues, things like setting up bank accounts. We'll also have some volunteers who are support group leaders. I think I can see that Bobby's in here. She's one of our volunteers, and people could get in contact with her, and she could give advice to people about her experiences setting up a support group and how she did that. So then we'll provide ongoing support, promotion on social media, sharing resources, and then we'll have our volunteers. For example, David's been to Durham with me and our CEO Libs to open days, so we're really happy to go for representation and support as well, and give kind of any talks on things like travel, etc. too.
Oh, thanks for that, Shauna. There's a couple of comments in the chat. Someone thanking, obviously, thank you for you both, and particularly David for his life experience. Bobby's obviously saying the Run the Berwick support group started 13 years ago. I'm really happy if you want me to take it off mute, Bobby, to kind of say a little bit more about that. Just let me know if you want to do that. And there is someone who's basically saying that their mum has a stoma. sort of this year after bowel cancer, it's definitely a learning curve. That's something that you've mentioned, David, that sometimes when it's almost, sort of a very quick, sort of thing that, sort of happens, it can be, harder to kind of emotionally adjust, and she'll be directing to yourselves for some emotional support. So how do we, I mean, obviously this is the thing I find about these charities is you do such good work and you've got this, helpline. How do we make sure that kind of health professionals and other people who are sort of speaking to patients day in, day out can actually like know a little bit more about you? Is there any work that kind of Colostomy UK are doing around that to kind of promote awareness? I'm sure there is.
Yeah, so we try and keep in good contact with stoma care departments and healthcare professionals with the newsletter or attending events like this. And we do have the stoma care workshops as well, and that's delivering care, and that can be in hospital departments, in care homes. And we also do trainings which kind of like tackle people's attitudes and behaviours, because not many people do know about stomas, even in the medical setting. There is misconceptions about it. So I think as a healthcare professional and a social care professional, being okay to ask those questions, and also it is in the attitude as well. If someone is unsure about what a stoma is, or kind of you can visibly see them retract or recoil, the person who's living with a stoma will feel that too. So I think for us, it's all about that inclusive society, which obviously just comes from a point of misunderstanding and lack of education. So that's something that we really want to tackle. So not sure if you want to comment on any of your experiences, David, with kind of like health or social care professionals, and what would be helpful for you from them.
Like I mentioned, it was just by chance I came across Colostomy UK. And I think for me, if every hospital in every gastro ward had leaflets and gave it to every patient and said, these people have got lived experience. Because if you phone the helpline, more often than not, you'll be speaking to someone with a colostomy or a urostomy, sometimes both. As Shauna mentioned, we've got people who've had reversals, successful and unsuccessful. So I think kind of every person who's going to be living with a stoma, who is living with a stoma, should be given a leaflet when they're in hospital. I mentioned that I'd been in, had my prolapse repaired, my hernia repaired. I went around the ward telling people about Colostomy UK. And most people, like I said, well, a lot of people when they ring up say, oh, I've never spoken to anybody else who's got a stoma. It's not like unless we're at Colostomy UK events, we don't go around with t-shirts on saying I've got a stoma.
Yeah. No, that's great. I think that's what's needed, isn't it? As you say, sort of at the hospitals. There's a couple more questions coming in. Someone who's asking how you manage in a shower.
I'm happy to answer that. Like I mentioned, I change my bag once a day. I bathe with my bag on. I'm a bath person rather than a shower person, so I have a bath with my bag on, and then I change my bag. Same thing if I get a shower, I'll shower with my bag on. I know some people who take their bag off and then have a shower. That's just the way I've done it, really. I've been swimming in the sea, in a swimming pool. The only time water with the bag was I've been in a jacuzzi and I could feel my bag coming off. But I'm not a millionaire and I don't have a jacuzzi at home, so it's not a real great problem for me. But that's the only issue I've had. I shower with my bag on, as anybody else would.
Thank you for that, David. And another question about if few people kind of using stoma nurses, how does a person with a stoma access the nurse? Is there a waiting list? Do you know if people kind of have to travel for that?
So it's kind of the same with anything in the NHS, really. Sometimes there is just a postcode lottery. Some people in some areas have really good access to a stoma care nurse. The same if you have kind of any procedure with the NHS, they'll have the specialists, and you'll have like your specialist nurses and your specialist care. With stoma care nurses, a lot of them are sponsored by a stoma manufacturer or supplier, and they traditionally work kind of like 9 to 5 hours, Monday to Friday. So it's not as accessible as a standard nurse. So it's not so much there are waiting lists. The ratio from people living with a stoma to stoma care nurse are really overloaded with work. So it's just a case of getting in when you can. Some people manage to get yearly reviews, which is great to check sure everything's running, that you've got the right product. But that's not always the case. I'm not sure how your situation is, David, with your stoma care nurse, if you get to see them regularly.
Yeah, I must admit I was quite surprised by that statistic. I thought it would have been the other way around. Certainly, working on the helpline opened my eyes. People in the London and the southeast tend to really struggle. Personally, I know I've got stoma care nurses at the hospital where I had my surgery, which was the Freeman Hospital, and I can give them a ring and I can get an appointment there generally within a couple of weeks. I do have an annual review, but there's also community stoma nurses that I can get in touch with as well. Whether I'm just fortunate that I've been through the system and I've got all the numbers and I've kept the numbers, I don't know. But like I say, I was a little bit surprised by that statistic. I thought it would have been the other way around. Would have thought we would have been the 35% and people in the south and southeast would be the 29%. But that's just my personal experience.
Mhm. Thanks for sharing that. We'll wait and see if there's a few more questions come in. I guess I was just kind of going to ask about whether you have much feedback from people who can't kind of manage, sort of the care themselves. So I'm thinking people, sort of who might have kind of, vision loss, or might be in like a care home, or, sort of getting, sort of like home care services. If they don't kind of have like carers that are family, do you get any kind of feedback around that, and whether, sort of the kind of, sort of struggle? Do people providing care in the care homes and things know a lot about sort of like management of how does that work?
Just from a helpline point of view, I actually had a call a couple of weeks ago from a lady whose mum had rheumatoid arthritis in her fingers, and she couldn't physically change the bag because of the limited movement she had in her and the loss of sensation of touch. I normally recommend they get a care package assessment from the local authority. Whether that actually happens or not, and whether they get the care or not, I'm not sure. But that's the course of action I'll take. Recommend that they get a care package assessment. I've also had a call from a lady in Manchester from a care home who was looking after. I think it was a lady who was a resident who just had a stoma. I was just asking sort of general questions about how to manage a stoma.
Yeah.
So I was able to share my experience of what I do on a daily basis.
Yeah, because it is obviously very, so different from, continence care. So I wonder whether, sort of care homes and home care agencies think about that sort of training, like they would with, sort of other conditions, whether they might think, sort of to give additional training on that. But it's good that you can give advice to health and care professionals as well. And, sort of obviously that sounds like it's been, sort of really useful. Is there any other questions that people have coming in? There's another one there just saying, do most people get supply of bags directly from manufacturers or through pharmacies?
Do you want me to answer this one again, Shauna? Again, this is just me. I get it direct from a supplier who get products from the manufacturers. I go on the supplier's website, I order what I want. They then contact my GP with a prescription. Because it's a long-term medical condition, I qualify for free prescriptions. The doctor signs it off. The supplier delivers it to my home. The process normally takes about 3 days, and I order 3 months worth of supply, and I'll reorder when I've got a month's supply left, just to make sure. I had post-COVID, because I wear a specific type of bag, I was down to my last 2 bags because there was a problem with the supply. And from that moment, I've always ordered when I've got a month's supply left, because I was in sheer panic when I only had 2 bags left. Luckily, the stoma nurses at Freeman helped me out with a box and tided me over. So, yeah, it's a relatively easy process if you're computer literate. I know you can ring the supplier as well and put the order through by telephone too.
Thanks for that, David. That's really, really useful to get your own, sort of personal experience on that. We'll wait and see if there's any kind of further questions coming in, but I think you've kind of covered everything. What I would say is that we'll be sending out the slides, which do obviously have the local, sort of support groups in as well. And I will be kind of sharing with people who contact us that you can help to set up a local support group as well. There's a question, is that Coloplast? I think that's for you, David.
Yeah, it is Coloplast, although there are other suppliers available. Use the BBC phrase, but that's I use, and as Shauna mentioned, it's who I was told to use when I was discharged from hospital. So I know that in different, again, from working in the helpline, in different NHS areas, they use different suppliers, companies like Fiddlewith. There's another couple as well, but yeah, I use Coloplast.
Yeah. And I know you've said that you have a bag, and it's one of the only ones that's actually, sort of doesn't, sort of give you, sort of side effects, so you know exactly what you need to order and everything else. And that's long may that kind of continue in terms of that product being available. So I think that might be it for questions, but I'll see if there's any sort of further ones coming in. Thank you so much, David and Shauna, for coming along today and speaking to us. It really is much appreciated. And thank you everybody else for coming along to hear from Shauna and David about Colostomy UK and the support that they can offer. As I say, we will send out the slides. We have finished a little bit early, so you have 20 minutes back that, sort of maybe have a cup of tea or, sort of do something else to enjoy the rest of the afternoon. There's a few kind of thank yous coming in as well. I think everyone's kind of really appreciative of the information given today. So thank you very much, everybody, and no doubt we will see you again at the one of our next sessions.
Thanks, everyone. Good afternoon.
Thanks, everyone. Much appreciated.